Now, we have updated modelling, right? National Cabinet will consider from Doherty. Can you tell us anything about that?
Unfortunately, I can't. The modelling's done by the Doherty, together with a large consortium of modellers, about 20 modellers from 10 institutions around the country. And I can't share anything that I know, unfortunately. That will be discussed with the National Cabinet today.
Always worth asking. Hey, so I want to talk about where the conversation is centred on in recent days regarding the 70 and 80% thresholds. And we had the record 1,000 plus cases in New South Wales yesterday. Can you see, based on your original modelling, say for argument's sake, if a state like New South Wales had infections in the high hundreds, with even the strongest testing, the strongest tracing, the strongest isolation protocols, would it be safe to start any widespread lifting of restrictions at 70% vaccination if that was the case with the infection rates?
Yeah, look, I might just explain the thinking behind that, because if you open up with tens of cases or you open up with hundreds of cases, the numbers will start increasing. And the modelling was based upon the fact that if you open up completely at 70%, you'll get hundreds of thousands of cases over 180 days, which we don't want to see, of course. So factored into the modelling was effective test, trace, isolate, quarantine, as well as some public health measures. So there was no freedom day in the modelling at 70%. There never was. And so if a state was to open up at those sort of levels of hundreds of cases, we would want to be reassured that their test, trace, isolate system can keep up with that. And they will need some public health measures, and they range obviously in severity. And so it will be much harder to keep up with it in the hundreds, but it doesn't mean that you actually can't open up, but it is definitely a bigger strain on the test, trace, isolate system. Having said that, once you've got a lot more vaccinated people need to keep in mind at the moment we've only got 30% people vaccinated, so 70% of adults are susceptible. Once you've shifted that balance, it does ease the load on contact tracing. And also once there's that move from phase A to B, with some acceptance that there is low COVID rather than zero COVID, the goals of test, trace, isolate change. They're less labour intensive, but it still is a significant burden. So it's really factored into those capabilities, which of course also vary around the state and around the country. And for New South Wales, as we've seen, this has been very difficult to keep up with it at the levels they are right now.
Absolutely. Now, the National Cabinet today is expected to tick off on expanding the vaccine rollout, Sharon, to 12 to 15-year-olds. We do know the Therapeutic Goods Administration has already approved Pfizer for kids in that cohort. You have not included that cohort in your targets, your 70% eligible population figures. Will you give any consideration to including those teenagers to help readjust those targets once they are officially included in the rollout?
Yeah, so in the initial modelling, the modellers looked very carefully at the extra benefit of vaccinating certain populations on transmission risk. And there was very significant benefit of vaccinating 20 to 39-year-olds because of their working and moving around, and we've seen that, moving forward. And the additional benefit on transmission was for 12 to 15-year-olds was small. However, those models will be constantly updated based on available international data, based on data that we have here on how Delta's behaving. And no one is ever saying that we should not be vaccinating 12 to 15-year-olds. Absolutely, we should be vaccinating them. It's where they fit in that priority queue on what's going to have the biggest effect on transmission. If we had unlimited vaccines, this would not be an issue. So there's multiple factors that will go into that decision. First of all, ATAGI's recommendations are really important. 12 to 15-year-olds can get vaccinated now, certainly in vulnerable children, children with chronic illness or First Nations children or in rural communities. It's really important that people are aware of that, and it's a matter of whether it moves from those vulnerable children to all children aged between 12 to 15, and I gather that's being discussed today in National Cabinet.
OK, so but the 70% figure at the moment includes the eligible population of 16 plus. Taken out to the broader population, that 70% is more like 55, 56% coverage. Do you see any scope to lower the eligible population figure included in those targets to 12?
There may well be. Okay. As the modelling should be constantly updated with the latest information latest insights, the models, our own local epidemiology. And that's what this team of modellers are doing night and day. They're constantly reviewing new information that's coming in, and they may well update things.
I want to ask you finally about what in your view does relatively free Australian life mean once we hit 80% and, gee, hopefully more than 80% by the end of this year or early next year. We had Kerry Chant, the New South Wales Chief Health Officer, saying this week that, for instance, mask wearing indoors at least could be around for a long, long time, even if we hit 80% plus. What do you see as those restrictions lingering after 80%?
I think, first of all, there will be restrictions. It won't just be not going back to how we lived before, unfortunately, but there will be many more freedoms. I think there'll be different restrictions on vaccinated and unvaccinated people. There may well be public health measures such as mask wearing indoors or on public transport, depending on how transmission is happening when we have 80% vaccination. There may well be limits on large events, for example. But the good things are that we will hopefully have a more open international border with different caps for vaccinated and unvaccinated returning travellers. And also, I think this is a changing environment. By the time we reach 80%, we may be using rapid antigen tests differently. There may be greater insights also in our treatment, access to new treatments, for example. So it is a constantly changing environment. But I think the high-level message is it won't go back to normal. There is no Freedom Day. There will be some public health measures. We've shown in Australia we can do this really well, and hopefully the public health measures that persist will have the minimum impact, things like, open schools, open retail, open restaurants, but there may still be some limitations. It won't be like life was, unfortunately.
Yeah, good to get that reality check at the end. Sharon Lewin, as always, thanks for joining us.
Thank you, Michael.